combining here and using lasers in this field is giving us a very promising and a very good help. As you can see it here, the removal of this caries defect, you will see not a round or a square deep hole, but just the fields where we have the infected materials have been removed with the laser, and all the other sound and healthy material remain. So we can say with the laser we have a minimal invasive therapy removing caries. Also in the field here, where you have a very deep secondary caries after removing an old amalgam filling, I was able to remove these parts, even that you have a certain kind of shining already on the pulp. You can see that there's only a very, very thin layer left. But we know using the laser we can remove all the infected material. You see even here that is almost opened here. There's already a tertiary dentin layer which was placed already in former times. And we can be happy that using a laser there is no infected material remaining on such a surface. Or to remove very selective old fillings. As you can see here, I removed this old filling, and this filling was done before in a conventional method. You see the kidney form here. So to remove the old filling, I can use a laser, still having the old traditional preparation left behind. We are not cutting out a lot of material. Also, removal of old fillings can be done in a very nice and selective way. And by the way, the most nice and challenging thing is that I can do this treatment without any anesthesia. So that is a very funny thing maybe to you, especially in tooth area, which are very sensitive, that we can do that with laser. I cannot explain to you now the mechanisms. I can see my time is running like something, but it is a wonderful therapy in order to be also minimal invasive for pit and fissure sealing or enlarged pit and fissure sealings where we have to remove some caries with different settings. We are removing the enamel, then the dentin parts. You create a retentive surface without any additional etching, and you place later on your filling in a nice way, and patient is going off without any problems and without any anesthesia and without any other parts, even going down to deeper areas. The dentin is very comfortable and can be treated. What we have been forcing forward, we are combining modern techniques. So in our department we are not only working with lasers but also working with the CAD/CAM or CEREC system. And as you can see here, the preparation of this tooth was, the old filling was removed with a laser. So all the surroundings very clear and precise. That is the situation before taking the optical impression, and then later after placing the CAD/CAM overlay to this part of laser preparation. So we can place in a very nice way on laser prepared surfaces. I could also show you pictures of veneer preparations with laser in a very nice and precise way. So the combination here also to combine modern technology is very promising. But one thing which I really would like to forward to you, which is on my heart, I tell you, you will see a picture where I've been quite some years younger, is pediatric dentistry. I told you we can treat pain-free or less painful. So this is very important for patients who have a dental phobia, who are afraid of dentists, and especially for our young patients, children, who have to be guided in a nice way. So also for pediatric dentists we have a special approval for Erbium-YAG lasers to be used in all these treatment parts. So this was a young girl which had a lot of problems in school, having these discolorations. I could treat her, and she was very much afraid of dentists. I could treat her with a laser to remove these parts and to place a filling later on, or even smaller patients, a small little boy having a deep caries in his molar part. All the treatment was nicely done without any anesthesia and the follow-up filling. So you have very nice and happy young patients, and they are opening a door the parents will come after a while, relatives, friends, neighbors, because they have a complete different approach. Yeah, a complete different approach to a dentist. And since I have now a follow-up of more than 14 years having these young patients, some of them are already on the university and they just come in time by time, maybe once a year, and say, okay, hi doc, I'm here. I just want to have a little control, and they have a complete different approach to a dentist than normally. When I still remember when I was a small boy, maybe a bit older than him, I was told, you don't cry, you sit down, you open your mouth. There was no anesthesia, and then they started to drill my molars, and I still can feel the vibration, how painful it was, and I said I will never ever become a dentist. It was the most hated thing that I could think about. But you see, sometimes in life things are changing. So. But still, I still remember I want to go in an area where we can treat more painless. And on the other hand, also in a field of aesthetics, we can find a nice approach using very specific indications and settings with a new type of wavelength and urban laser to get nice results in aesthetics for bleaching. Yeah? This was combined with the highlight, chauffeur system, the urban laser, and the applications under standardized conditions in the mouth. That is the special handpiece for this procedure. And later on we measured all the color differences in an electronic way, because sometimes patients, if you treat them for a while, they will not see the big difference. They are used from A3.5 or A4, then they go to A3 and then to A2, and after they reach A1, they will say, oh, there was not such a big difference. So you have to really show them what was the initial situation and what was the follow-up situation, as it is here, an A3 here, an A1 here, or also here B2 and the B1 after one treatment session with a laser. And the big thing is, it is very fast, within 5 minutes of irradiation, maximum 10 minutes for a second treatment, no post-operative pain, no hypersensitivity, which is normally following the normal bleaching process. So this is, again, minimal invasive to the pulp, and for the patient it is very helpful. Or here, as you can see here, I was doing a treatment to a patient which was referred to me because she was complaining about the situation. She got 2 new crowns in the upper incisors, but as you can see, the other teeth are quite yellowish, and also tooth neck defects. So all the treatment was done now by urban laser. I used my urban laser. I removed, I first did all the bleaching effect, and later on I treated the parts where we had the tooth neck defects. That is the bleaching process following this part, and that is the final situation. And I think you can, the patient and yourself, you can be happy and proud at the same time. Now, even that these 2 crowns have been placed in a way which were not so nice, but at the final end, we had a very nice situation. All the colors are matching nicely, the tooth necks are filled nicely, only with laser, without any other process. And also, just some cases out of a long-term study, which we have been taking. I think we have very nice improvements without having any problems to our gums. Also here, an A3.5 up to an A1. I think we are very happy to combine now the different kind of treatment processes. That means in some treatment areas we can achieve much better results with the laser than with conventional methods. We have seen it. On the other hand, there are some areas, such as, for example, classical crown preparation, we cannot do with the laser right now. I'm just showing you 2 parts, but what is certain, what we can see, and what I can see traveling through many different countries and continents around the world, the integration of laser systems in the spectrum of dental therapy is unstoppable. So it's up to you to make up your mind and to think what is possible for you, how you can integrate a certain kind of laser wavelength or system in your dental office concerning the needs or the areas you are treating.